HIV is a deadly virus that causes acquired immunodeficiency syndrome, or what's commonly known as AIDS. It popped into existence in the early 1980s, but where did it come from? At first, the Center for Disease Control conducted a study that placed one man at the center of this epidemic. The 31-year-old Canadian flight attendant became known as Patient Zero for AIDS. At a time when gay culture was largely illegal, the public soon blamed him for starting the disease. Scientists, however, suspected that he couldn't be the first human to get the virus, and so they started collecting samples of HIV from multiple patients inside the US. They soon discovered that the disease has been evolving in the US long before Patient Zero could have ever been infected. In order to find the origin of the disease, scientists also looked at tissue samples from the past, which doctors had preserved from patients who had died strange deaths. Primitive versions of HIV were found in several human samples, and scientists started examining different strains of HIV to find a connection. One researcher found a strain of a chimp virus that was almost identical to a human strain found in Africa. The strain was a virus called SIV, which is a common virus among many species of chimpanzees. The leading hypothesis says that an infected hunter would have visited or moved to a large city in the early 1900s, where prostitution and sexual contact would have been easily found. And while it is clear that the few strains of HIV descend from SIV, some loose ends remain unresolved. Me and Plethrons made another video over at my channel, so make sure to check it out and let us know what you think in the comments section below. I'm Jack, and thank you for watching.